Good afternoon, everybody. This is Kate Varian. I'll be your webinar host this afternoon or morning if you're still on far West Coast time. Now, to get started, I just wanted to make sure we have some housekeeping done. If you have any comments or questions throughout the webinar, there is a box. It's the chat box in the top right. If you can't hear me speaking now, it means you need to call in. Obviously, you don't know that if you haven't called in already. The topic today is going to be Medicare supplements versus Medicare Advantage, how to position them to your clients, and basically figuring out which one's going to be the better advantage for you, for them, and for the company. All right, so let's get started. Today's topics. This is how we're going to go through this presentation. Like I said, if you have questions, please ask. I will address them at the end. And then if you have any comments or concerns throughout, again, just put them in the box, and I will do my best to address them as they come up as well. Now, first thing we're going to do is definitions. I'm not assuming any prior knowledge to both arenas. Medicare supplements and Medicare Advantage are two different animals when putting them in the Medicare market. Second thing we're going to go over is availability. Contracting followed by restrictions. That's going to be the advertising restrictions, lead restrictions, how you can contact your client restrictions, followed by enrollment periods. Special enrollment periods are a whole new animal, especially with plan exits in some areas, so I do want to address that as well. Now, the last thing we're going to do is presentation to the clients. How do you position them flat out? How do you describe both plans fairly without spending hours doing so? And then finally, a cost comparison. Which one makes the most sense? Now, definition. Medicare Advantage. It's a type of Medicare health plan that's offered by a private company that contracts with Medicare to provide you with all your Part A and B benefits. Now, it is government funded. So what this means is it is not going to be accepted at a veterans hospital. VA benefits do not work with Medicare Advantage. Medicare supplements. That is a Medigap policy sold by private companies that can help pay some of the health care costs that original Medicare does not cover, like co-payments, co-insurance, and deductibles. Because it's completely privatized with no government funding, you can use it with the VA. Now, it does cost more money in general than a Medicare Advantage. Of course, there are some exceptions when you start getting a very all-inclusive Medicare Advantage plan that costs $199. But again, that's an exception, not the general rule. Availability. You really do need to reevaluate key carriers in your market annually. For instance, we have plan exits happening in Virginia, North Carolina. We have expansions happening across the country for Medicare Advantage. So where you may not have had that option with clients before, you do now. And vice versa, when you have a plan exit, maybe you need to take a look and see what other Medicare Advantage plans are there, or if by default, Medicare supplements. Now, if you have any questions, you can use our quote engine. CFG Actuarial is a third party. It will show you everything available in a zip code for any time that you want to search for. So you can do a January 1st effective date and see what is available in that tool. It is not tied to nice loss and funding. We just pay for a free subscription for agents. So it's not going to be geared towards carriers that we offer. In fact, it offers everything regardless of our contract or yours. And of course, you can always call us. We'll guide you to the best companies and plans we know in that area, as we are a national company. Now we're getting into restrictions. Medicare supplements. You can cold call for Medicare supplements. That is a very big issue. A lot of people don't understand that you can call for Medicare supplements since they are not government funded. They are not regulated by CMS. You can call for ancillaries as well. Medico being a prime example. You can call and actually enroll people over the phone with a voice signature. So if that's something you're interested in, we can of course guide you through that process. There is an exception. Ohio and California, they have rules against calling. So what a lot of agents do in that case is they actually mail. They mail kits out, hoping for a response. Of course, it's expensive. There are limits for ordering kits, but it's something that people do. Now, if you need prospect lists, who can you call? We can get those to you for free. A lot of people aren't taking advantage of this. It is no cost to get a prospect list. Just call your sales manager here at Neishloff and Fleming, and we'll get you one. We scrub it against the National Do Not Call Registry. We can sort out with phone numbers or without. So if you just need people potentially to mail to, we can give you a list of everybody ages 66 in Broward County, Florida, if you really wanted that. We can do that for you. And we can do that as many times as you want. Just let us know and we'll get that for you. Just remember, it's just a telephone. They can't hurt you. It's really the most difficult thing is making the phone call. With Medicare supplements, there really is no CMS guideline regarding phone calls. Medicare Advantage, however, they do have a lot of restrictions. You can never cold call for Medicare Advantage. This does not mean you can't call your current book of business. Of course you can call your current clients, set appointments and things like that. They've given you permission to contact them by having you as the agent of record. Now, don't use the prospect list and talk about Medicare Advantage. That's a very big no-no. If you get caught, you will get fined, you can get your license taken away, and you can lose the opportunity to sell in the future with that carrier. What you need to do with Medicare Advantage for leads is lead mailers. What this is it's a mailer. It could be branded or unbranded. It could be custom marketing, or it can be something from the carrier. It gets sent out to these potential prospects. They send it back, permission to contact regarding Medicare Advantage. You then have their number or their email address, whatever they fill out on that card, and then you have permission to contact them through the method they gave you permission to contact them through. In that case, then you can set appointments, you can talk to them about doctors, you can talk to them about plans, you can do the whole thing. You just need to make sure you get a scope of appointment before going and signing them up. But it would be irresponsible of you to not ask for basic information when booking the appointment. For instance, if they have any doctor or medication concerns, you can ask for that so you can pre-check and qualify them for plans so you're presenting what's in the best interest of your client. Now, other ways to get leads for Medicare Advantage that are compliant are response cards. That's where you get the card back. There's other ways you can get it. The client calls you back. So there's a couple ways. It depends on the mailer you choose, what method. We found that more people tend to send in response cards, which is why we like to use that brand of mailing. However, if you're using the local agent kind of custom piece, you're obviously going to get a better response with client callbacks. It depends on your area, which is why it's important to call us. We do have experience. We do know what doesn't work based on trial and error that we do in-house consistently. Then, of course, there's online responses. The reason I'm talking about this last is because when people are online clicking to find out about Medicare Advantage, that's called an online lead. So it's a click lead. When you're on the internet and searching for information, you can sometimes click on 4 or 5 different things, and then all of a sudden, you have 20 phone calls that you missed. That would be what's going on with that lead. So if you get one of those, even if you have exclusive rights, there's no guarantee that client or that prospect didn't click on 3 or 4 after that one. So we don't tend to utilize those here at NNS because we found the response rate was just not cost effective, and the lead was considered dead if you didn't call within 60 seconds. So who wants that kind of responsibility and phone alerts? Now, why all these restrictions? I've mentioned it throughout this presentation a couple times. It's CMS, the Center for Medicare and Medicaid Services. Because the government funds a portion of the Medicare Advantage plan to lower the cost of the options, they then have the right to regulate. Follow the money. That is what's happening here. They also use the star ratings to dictate where the money is going and how much. For instance, when you see a plan with a 4.5, 5-star rating, if you're lucky enough to have a 5-star rating plan, the odds of that plan having great benefits the next year is very high because they're going to maintain that star rating and get higher level funding. Now, if you see a plan potentially with a 2.5 or 3-star rating, it's a little shaky whether or not those benefits are going to even stay the same the next year. So when you're looking at plans for your clients, if you want to be able to look them in the eye and say, yes, this is a good plan for you, and you know that you're not going to have to go out there year to year and switch them consistently, it saves time for you if you get them in a higher plan, then you're going to want to stick with the 4-star rating and up. It means a richer benefit to come. Next up, enrollment periods. This is where you start seeing some differences between Medicare supplements and Medicare Advantage that really go into how you as an agent are managing your book of business. Obviously, the initial enrollment period is the best. These are people that are turning 65. You have that 7-month window, 3 months before their birthday and 3 months after their birth month, where you can write them in any plan. Now, the initial enrollment period can also be when somebody is coming off of an employer plan, if they're late to retire, for instance. There's other cases where they could have their initial enrollment period, but typically it's when they turn 65. So this also may be the only chance for a lot of people to get a Medicare supplement without having to go through underwriting. Because people with disabilities typically have had Medicare previously. They may already be in a Medicare Advantage plan or a supplement. They also get a second window, so they have a second chance to enroll without underwriting for a Med Supp or a Medicare Advantage. Initial enrollment periods are pretty straightforward. If you have any questions, you can just give us a call. We can walk through that. The annual enrollment period is really what we're focusing on right now at this time of year. We have it from October 15th to December 7th is where everybody is focused completely on Medicare Advantage. There is no underwriting when switching Medicare Advantage plans this time of year. This is the only time of year you can switch Medicare Advantage. Now, with Medicare supplements, you can actually switch month to month. So this time of year isn't as vital for a med sup. If you are looking at age 67 for a less expensive Medicare supplement, you can switch any month you choose if you are capable of passing underwriting. Now, each company has their own standards for underwriting. However, typically you can get into a plan, United Healthcare, for instance, if you can answer no to these two medical underwriting questions. Have you been recommended to have surgery in the last 2 years? If the answer is no, you can get in. And then the other question is, do you have end-stage renal disease? If the answer is no, then you can get in. Other Medicare supplements are a little more strict. It's how they internally regulate their rates and keep them low and competitive for years to come. So keep that in mind when looking at enrollment periods. Right now, the focus should be Medicare Advantage. This is when people can switch. A Medicare supplement, you can write them in January, February, March, April, May. If they can pass underwriting, they can switch as much as they want. Now, special enrollment periods. This is where there's a lot of confusion this time of year because we have plan exit going on. So there's a lot to do with, for instance, in Virginia, United Healthcare is actually moving out of a couple of counties. In North Carolina, Humana is leaving a couple of counties. Texas, there's a lot of movement there as well. That's where clients are getting these letters of plan changes and exit, and they're concerned. They might happen in the middle of the year. They might happen, like right now, AEP, so it's convenient. You were planning on seeing them anyway. But that would be a special enrollment period. Now what's going on with Cigna HealthSpring, for instance, if they do not get out of sanctions with CMS, they may have a plan exit. This could happen anytime, or they could be reinstated. We don't know. That's between them and CMS. That would be an example of a plan exit that would open up another initial kind of enrollment period for clients. So they can enroll back into original Medicare, a Medicare Advantage, or a Medigap plan. But that would have to be where there's a massive exit. And there's nothing these people can do because it's not during annual enrollment. Now, if you're newly dual eligible, you also have the opportunity of a special enrollment period. So during annual enrollment, if you come across somebody who is actually Medicare and Medicaid eligible, and they have both cards, you can actually enroll them at any time, and they can switch month to month. So you can get them on a plan just in time for annual enrollment, but if you see them in October, it could actually be a November 1st effective date. So it would actually pay commissions in November. So that's key. When you're talking to these people, you definitely want to pay attention to their income level. Now, if you're moving out of a plan area, then it's really only going to affect MA people, Medicare Advantage. Because if you have a Med Sup, there are no restrictions on who you can see. A Med Sup is a Med Sup. It's good across the country. It's good everywhere, any doctor, anytime. Medicare Advantage, now if you move from one county to another and they don't have that plan option available, you opened up a special enrollment period where you then have the opportunity to pick a new plan without having to go through underwriting, but also without having to worry about penalties or loss of coverage. You have about 2 months after you lose your current coverage. So you have 2 months, 60 days after you move to get enrolled in a plan. These people need to make sure that they do that as soon as possible, because if they wait longer than that, then you do actually have penalties to worry about, and you have to wait until annual enrollment period, and you basically return to original Medicare, and you don't have coverage until the following January, no matter when you moved. Okay. I've got a few questions here. The 7-month window for Medicare and Medicare Advantage and Medicare Supplement plans. That is the turning 65 window. So when you turn 65 or when you leave employer-funded plan, you have 3 months prior, the month of your birthday or the month that you left the plan, and 3 months after. And you can enroll at that time in either Medicare Advantage or Medicare Supplement without ever having to worry about underwriting. Okay. So that kind of covers the next question as well. If you are on a group plan, your initial enrollment period will occur the month you get off of that plan. And then you've got 3 months after. If you choose to stay on the group plan, first thing I want to make sure everyone does is advise your client to speak to their HR representative. Because in some cases, because it's very expensive to keep people on these plans, they'll actually give a stipend for a Medicare Supplement or Advantage, however the employee chooses to spend the money. But if you continue working for an employer, you will automatically be enrolled in Part A when you turn 65. So you'll have that. As long as you have credible drug coverage through the employer as well as health coverage, that is considered a good plan by the government, and you don't have to do anything. When you enroll in Part B, then that's when you start looking for your initial enrollment. If you have more questions, of course, I'll talk more about that at the end. I just want to make sure we don't spend an hour talking about this, especially when we have more to get into. So, product selection. Why would somebody choose Medicare Advantage over Medicare Supplements? A lot of people don't even know the differences. When you go into clients' homes, they don't know the terms Medicare Advantage and Medigap sometimes. They don't know about supplements. They don't know anything. So it's your job to educate them. So going into a home with Medicare Advantage, where this is probably going to be the winning hand, is when you have somebody with an extremely small budget, people who can save money, that aren't afraid if they go to the hospital that they can afford to pay because they have some money in the bank. They can pay those hospital costs at a later date when the bill comes in at $2,000. That's something that they already accounted for. People who cannot pass underwriting. Maybe you have somebody who's 67, they dropped their Medicare Supplement because it was too expensive, and then they find out they have cancer, they need health coverage, they can't pass underwriting because they had cancer. What they're going to need is a Medicare Advantage plan and get them in the best plan available. At that point, start doing cost analysis with them. Really make sure that they get the best plan with the richest benefits in their area. Because if they can't pass underwriting, it means that they need the coverage. And then, of course, the people who are, well, I need to, save money now. I would rather pay later. It's a personality type. When you're looking at Medicare Advantage, you have to think of it as an opportunity to save money. It's an opportunity. It's not a guarantee. A Medicare supplement, however, is a guarantee of your cost. So Medicare supplements are typically people who have a large savings to protect. They like predictable costs. They plan on utilizing medical coverage. So those people that were on Medicare and Medicaid that now had a special enrollment period, second special, initial enrollment period, when they turn 65, they should go on a med sup, no doubt, because if they had disabilities that put them on that plan prior to 65, odds are they're going to need it after. So that would be the people that would not be able to pass underwriting later. And then, of course, people who would like to prepay so that they pay less in total. Another thing, veterans with Medicare supplements. You can choose to use a Medicare supplement at the VA. If you have questions about how that works, I've actually talked to the billing department and how they bill. You can give me a call. It's actually very simple, but the supplement will cover the deductibles and everything in the hospital. They choose whatever's going to be least expensive, and then if the hospital can't fit you in the time frame you need, now you have the option to go somewhere else as well and have that coverage. You're not restricted to the VA, and the VA likes patients who have Medicare supplements. That does not include TRICARE. TRICARE is a whole other animal. If you find somebody with that, do not mess with it. It is the best plan available. It is the golden ticket of Medicare. Another thing between Medicare Advantage and Medicare Supplement would be travel. Medicare supplements have no restrictions on who you can see and where. Medicare Advantage, typically they have a localized network, an HMO, a PPO, it's defined. Now, some companies do have travel passes that you can activate. For instance, UnitedHealthcare with the Passport program, where the client calls ahead and says, I'm going to be traveling to this county in a couple of weeks. I'll be there for 4 months. You can activate it so you're now using the local network where you're going to be traveling to. It doesn't have to be for 4 months. It can be for a short period of time if you truly want to go through the hassle of calling every time. Of course, you need to call when you get back as well. You can do that up to 9 months of the year with UnitedHealthcare in particular. I see. What is the max income for a dual? In Pennsylvania, for 2015, it is $15,437. That is different state to state. And of course, it also will be different based on assets for the individual. You can call UnitedHealthcare and check the status of any individual with or without them being present. So if you have that question about someone in particular, get all their information, date of birth, Medicare ID number, and then you can just ask and they will tell you yes or no, they are dual eligible. But that is all going to be up to the state, and it changes every year and can adjust at any time based on state regulation. So that kind of summarizes what the biggest difference is between a Medicare Advantage and a Medicare Supplement to a client. In summary, it's like if you get a Medicare Supplement, it has been described to me as prepaying a plumber in case something goes wrong in your home. Medicare Advantage is like saving the money and then knowing if something goes wrong with your plumbing, you're going to have to pay a plumber more when it happens than if you paid them in advance. It's very simplified that way, but just remember, Medicare Advantage is an opportunity to save, and a Medicare Supplement is a guarantee of cost. Now, when you're presenting this information to your clients, you're probably thinking to yourself, how do I present this clearly? Talking about it, sometimes things get missed. UnitedHealthcare actually has this Medicare Made Clear PowerPoint presentation. I would be happy to share with everyone who attends this meeting. Medicare 101 is from Aetna. It's, again, a fantastic PowerPoint presentation. It's very simplified. There's the Clarity booklet for UnitedHealthcare that is client-facing. So if you didn't want to use a PowerPoint on your computer or an iPad, you could actually hand them in person a booklet that they can take notes on. In fact, there's note pages. It's meant for that. You can actually order on the toolkit, or if you needed any assistance in doing that, again, you can call us. And we'll get some to you. And then, of course, there's visual charts, comparison statements. You can utilize anything from this presentation, or you can go online. There's a lot of stuff, but you just want to make sure that you're doing everything compliantly. So I urge you to go through the first three choices before trying to reinvent the wheel. Okay, now this is a visual chart. This one right here, I myself used when trying to explain everything to my grandparents and parents. Basically, it's how Part A, B, C, and D work together. Part A is for anything that will admit you into a hospital. Part B is anything that's going to bounce you in and out. Doctor visit, ER, something short. Part C is anything that completes your Medicare costs. So it's something to complete what Part A and Part B don't cover. And then there's Part D for drugs. You can combine all of this together, or you don't have to. You can. There is always an option to have Part A, B, and D. That would be original Medicare with a drug plan. You have to have credible drug coverage in order to avoid any penalties in the future. Those escalate very quickly. Now you can see here, you have to have Part A and B to get Part C, which would be Medicare Advantage. Most Part Cs cover a Part D plan. You can have somebody who may not have a Part D included in their Part C, their Medicare Advantage plan. Those would typically be plans issued before 2012, I believe. There were a few available. Now, a Medicare Supplement does not cover drugs. So you would have to make sure you get them a Part D as well. So as you can see, everyone, Part A and B, and then you can get C and D, or a Medicare Supplement and D. Or you can get Part A, B, and D. It's just a visual to explain. Feel free to utilize this. I find it very helpful. Another thing you can use, a comparison chart. This one I have here, it's very simplified. In fact, I urge you to use something like this, go back and forth, comparing each one. and then ask your client which plan makes more sense to you, and do that before showing them the rates. So you pull this out and you say, okay, I'm going to describe to you Medicare Advantage and Medicare Supplements. We just went through what Part A and B did, how they all work together. Now I'm going to give you some ballpark information. For instance, Medicare Advantage, there are low monthly premiums, and there's actually some plans as low as $0. Now, with Medicare Supplements, the monthly premiums, they can typically range between $95 to $185. Of course, this is different on your area. Then you go back. For Medicare Advantage, all rates are the same based on a service area, usually by county. Now, Medicare Supplements, rates are frequently based on age, sex, tobacco use, so you can have increases on those categorizations, not just in big groups. Medicare Advantage, guaranteed issue. Sometimes that solves the problem right there. They know they can't pass underwriting, they missed their window for a supplement, they need a plan, Med Advantage is the winner. Medicare Supplement, it's going to be underwritten unless they're getting in during their initial enrollment period, and certain guaranteed issue exceptions, which would be a major plan exit. Now, Medicare Advantage, there's going to be copays. The max isn't $7,000 anymore, it's $6,900. However, you can tell them max out of pocket will typically range between $300 and $6,900. Medicare Supplement, if you get a Plan F, it covers everything. You just have to worry about deductibles if you choose a Plan N or a Plan G, in which case you can get into those details if they choose to go the Medicare Supplement route. Then you say, now back to Medicare Advantage, annual plans must be approved by CMS, so they're not guaranteed to be the same every year. And that's when you can go into star ratings and why they're important to look at. And then Medicare Supplement, they're guaranteed renewable plans. The government has said, if you want to offer a Plan F, this is what it must include. Now battle it out for the price. That's it. A supplement is a supplement, no matter the carrier. What you have to watch out for is whether or not there's going to be big rate increases. And that's going to be determined by the company's stability, rate increase history, age increase history, different factors that, again, you can find on our quote engine. Market analytics will be able to break that down for the last 5 years and a prediction for the next. Now back to comparison for clients. The last one is probably going to be the most important. Medicare Advantage can have networks, such as an HMO and PPO. And then for Medicare Supplements, any doctor, any hospital that accepts Medicare, period. So from that, the client will clearly have made their own decision. They want to go for Medicare Advantage because they like that zero at the top. Or they might choose a Medicare Supplement because they like that it's guaranteed renewable and there's nothing to be paid later. That's their choice. Another thing for you, cost analysis. This is something you can talk about. This is an example. Keep in mind this is an example that I made involving plans in North Carolina because they were the most general and I see the same kind of benefits across the country. In this case, you can see the potential savings, even when things go wrong, is in favor of a Medicare Advantage plan in this scenario. I'm going to describe the scenario to you. In North Carolina, with United Healthcare, there's a Medicare Advantage plan with a $19 premium. If you see an in-network PCP that is recommended, it is a $0 copay for 6 visits. Let's say this person went 6 times a year. The specialist copay is $35. This individual happened to have a heart issue and had to see a cardiologist 4 times a year, once a quarter. That's $35 a visit. Now, like I said, this person, this individual who has the heart issue, ended up with a 3-day hospital stay, which is the national average for a hospital stay. On this plan in particular, it's $395 per day, days 1 through 4. So we multiply $395 by 3, and we get the cost for that hospital stay, which actually is $743. Now, they had a follow-up outpatient surgery for $375, and then that kind of completes their medical costs there. The reason I'm not taking drugs into consideration is because the plan, if you get a plan that covers their drug costs with a competitive formulary, it's negligible. So that is just negligible cost across the board. Now, a Medicare supplement in North Carolina. If you choose a Plan F, you could end up having $200 per month, or it could be less depending on the area. There is a Plan F through Aetna at $120 per month, and of course that would make it for a lower annual cost. And then there's a drug plan. If you choose a plan, average cost of a drug plan is about $35 per month, depending on formulary. So as you can see in these 2 scenarios, the same person would have these 2 vastly different costs. Now, there could be an opportunity for even greater savings with the Medicare Advantage if that individual didn't actually need to go to the hospital for 3 days and stay. If that was the case, the cost would only be $743. So that, as you can see, is an opportunity for savings. However, it could drastically go the other way. This plan in North Carolina, the United Healthcare, has a maximum out-of-pocket of $6,900. So if things went drastically the other way, they could be on the hook for $6,900, which would have lost them $4,000 in comparison. The difference between $6,900 and roughly $2,900 being $4,000. So you can see it's going to depend a lot on personality type at this point. Do I feel lucky? But also, what is my family history telling me? And then thinking, okay, maybe for the first 5 years, when I turn 65, I bet until age 70, I'm not going to need to use my Medicare Advantage very much. So I have the opportunity to save an awful lot of money for 5 years. Now, when you turn 70, odds are you're going to need more medical coverage. Now, I won't be able, potentially, the person, to pass underwriting at age 70 and get into a supplement when I need it the most. So that kind of person, they have to make that decision. Will I have saved enough in the first 5 years with my less expensive plan to be able to afford not having that complete coverage at age 70 when I can no longer get that supplement? It's It's very much up to the person. We've got agents who are in one house versus the other on their views and how they present this. In my opinion, I believe that a true broker presents them both equally. You show somebody the advantages and disadvantages of a Medicare Advantage plan, and the same thing goes for a Medicare supplement. Overall, an advantage with the Medicare Advantage plan is it costs less. Disadvantage, you're on the hook for more if things do go wrong. Medicare supplement. Advantage, you know exactly what you're paying no matter what goes wrong. Disadvantage, yes, you could be potentially paying more than you would have if you didn't have that plan at all. Keep in mind, people are coming off of group plans where they may have already been paying $200 a month in health care coverage just to stay on a group plan. My parents, for instance, for the two of them in Illinois, they pay $1,400 per month for the two of them to have coverage. They're in their late 50s. It's because they're self-employed. So them going on to Medicare supplement when they turn 65 is going to be a huge savings in comparison. So again, you have to look at everything. So again, the client comes first. You have to make sure that you are presenting both options because you want to make sure you have a quality presentation. If you only present Medicare supplements to somebody and then an agent sees them the next year and talks about Medicare Advantage, they may be confused and switch. They may feel shafted by you. They might feel misinformed. They may feel that you couldn't offer them Medicare Advantage. So why call you and ask any questions? You don't want to lose that client. So if you don't present both options and you don't have an offering for both, then you're doing yourself and your client a disservice because you can potentially be losing out on your renewal, and having bad retention is never a good thing when you're an agent. So that completes the overall bulk of the presentation. I wanted to get through it before answering more of these questions coming through because I know it is a longer presentation, and I myself sometimes drift on webinars, so I didn't want to